Civic Center TV salutes West Bloomfield area businesses with The Biz, where local entrepreneurs share their unique insight and knowledge on a wide variety of subjects. The Biz is produced with the support of the Greater West Bloomfield Chamber of Commerce. It's time now for The Biz.
According to the CDC, 5.9 million children ages 3 through 17 are diagnosed with ADHD. Hi, I'm Brooke Allen from Civic Center TV, and on this edition of The Biz, we're talking with Dr. Eric Mintz from the Neurospinal Center of Michigan, where we're learning some natural treatments of ADHD.
ADHD is attention hyperactivity disorder. There's actually 3 different categories of that. There's the inattentive type of ADHD, which is what most people associate what used to be called ADD. So inattentive, usually a child or an adult has a hard time staying on task or focusing on something. They get distracted easily. Then there's the hyperactive component of it, or the the person can't sit still. They have a hard time, children in class paying attention. They might blurt out answers to things that they shouldn't be, or getting in a lot of trouble. And then there's the combined type, which has inattentive and hyperactivity. So there's actually 3 different types of attention hyperactivity disorder.
When treating a condition like ADHD, there are different methods.
So, there's 2 different approaches, essentially. There's the Western approach, which most people are familiar with, different types of medication, and usually what they'll use is a stimulant. And most people are familiar with Ritalin, Adderall, Concerta, and there's others as well. That's typically the Western medicine approach. The more, I guess if you want to call it more holistic approach, more Eastern type of approach, is using different types of therapies, whether it's things like acupuncture, neurofeedback. Some people use occupational therapists to help using different modalities as well.
What types of exercises can patients do to ease the symptoms of ADHD?
Exercise is crucial for the brain because the brain needs movement, needs stimulation. And whatever the exercise is, it doesn't really matter. I generally like to recommend things like yoga, martial arts, like taekwondo or kung fu, karate, things like that incorporate breathing and incorporate movement together. Swimming is also an excellent exercise, again, breath and movement.
Are there supplements or vitamins that patients can take to help with the symptoms?
Fish oil is very important. Calcium and magnesium are very important. The B vitamins are very important. All of these are crucial to help a brain as it's growing and developing to be able to focus, to pay attention, to concentrate as well.
And can you tell us how sleeping habits play a role in ADHD?
Most kids usually need about 9 to 11 hours of sleep is ideal for kids between 7 and 13 or 14 years old. So if they're not getting that amount of sleep at night, they're already starting the day off in the morning behind the 8 ball, so to speak. So it's really challenging for them to be able to stay focused when they're already tired. So very important they're getting a good amount of sleep and having a good bedtime routine, winding down at the end of the day.
Along with recommending an organic and well-balanced diet, Dr. Mintz suggests brain mapping, which allows him to see areas of the brain that are dysregulated and regulating properly.
And imagine trying to drive like a stick shift car, but you can't shift from one gear to the other. So that's what happens when a brain is dysregulated, and if a brain can't shift, they're going to have a hard time calming down, hard time falling asleep or staying asleep, hard time focusing and paying attention.
Being able to determine the areas of the brain that are not regulating accurately allows Dr. Mintz to establish the needed brain training technique using neuroplasticity.
The patient is able to learn by watching something on a screen. They're hooked up to sensors that are connected to certain areas. Again, it's non-invasive and it doesn't hurt at all. But as they're watching a program, their brain is learning how to pay attention to itself better. It's based on the concept that the brain can develop new neural pathways. It's like learning a language or playing an instrument. And once you're able to play an instrument or you learn a foreign language, it's always there with you. So the changes are permanent and long-term because we're actually training the brain to pay attention to what's going on versus short-term. Like, for example, for like medication, it does a good job. It might help that child temporarily, but then if they're not taking the medication, then they're going to go right back to where they were.
We've talked about exercise, diet, sleep habits, and brain training, all natural ways to help symptoms of ADHD. I'm Brooke Allen for Civic Center TV, and that's your biz.